Hi, I'm Dr. Ratnakar. I'm working in Continental Hospital. I'm an orthopedician cum sports medicine specialist. I have 15 years rich experience. I'm practicing this for almost 15 years. So today I'm going to highlight on the shoulder injuries. Shoulder injury is the second most common sports injury after the knee joint, we can say. The shoulder injury is more common in athletics, or like a volleyball player, a basketball player, or cricket player, where you used to rotate the arm for everything. It doesn't mean only the sports guys will get the shoulder injury. Moreover, other shoulder pain causes is like a diabetes or any neglected injury. Most of the times shoulder pain patient won't visit to the doctor because shoulder is a 360 degrees joint. You can rotate all over. The patient will come when from 180 degrees to, if the range is coming up to 90 degrees. If you can't be able to lift beyond this level, then only most of the patients will visit to the doctor. This is not a good part. So shoulder contains outer big muscle, what we say is a delta, and important muscles are inner core, 4 muscles are there. What we say is a subscapularis from the front end, which is important for this movement, and supraspinatus, which is important for this movement, and infraspinatus and teres minor, which is important for other angle movement. These important 4 core muscles are good enough to rotate our arm in all directions. So most commonly, these are the injuries. And if you compare a shoulder joint, because it has to provide 360 degrees, the ball content is more, and it has to sit in a small cup. So it's a big ball and sitting on a small cup, so that it can able to provide 360 degrees rotation for that. So when the ball is big and the cup is small, there is other ligament called labrum. It has to support so that the ball will sit directly in the cup. The most commonly injured the labrum is a dislocation. Some people might feel in the sleep, or first episode usually happens with an injury. It might slip and fall, an outstretched hand, or a road traffic accident, or someone, the shoulder gets long and dislocated opt out. So if you once dislocated, if you are at the age of 20, the percentage of dislocating in the future is almost 80%. If you are at 30 years, roughly you can say the dislocation rate in the future without any injury also, it is 60%. So the younger you are, the more prone to for shoulder dislocation in the future. So most of the times it is better, if you got a shoulder dislocation, visit a doctor. Don't pull your traction and try to reduce it, because it will harm some other tissues also, and you might not notice some minor fractures will be there that will increase. So it is always, when you got a dislocation, which is more common in the shoulder injuries, visit a doctor, consult his advice, and the manipulation to be done under anesthesia. It is better. If it is habitual, habitual means multiple times, mostly patient will have a tricky movements, automatically it will get subside. But if it happens for the first time, visit the doctor, be reduced, then follow the physiotherapy, increase the strength of the muscles surrounding that. Mostly it won't come. If it comes second time and third time, it is better to get an MRI investigation to see how far the linear tear, what we say in common is a Bacard's tear. It is a tissue tear. Sometimes you might notice an bony defect, what we in terms we will say Wilson's lesion. So MRI can give a better picture. If it is unstable or something, sometimes rarely will depend upon the CT also, if it is weak spaghetti fractures. So most common, it's the repeated dislocation, we will notice a Bacard's tear. It is to be repaired by arthroscopy, by surgery. It cannot heal by itself. Any ligament in the joint cannot be healed by itself, because joint contains a fluid, it is not a blood or something. So it doesn't have a healing potential. Surgery is like an arthroscopic keyhole operation. So it depends upon the extent of tear, the surgeon will help you. So what is the protocol and how to proceed for that. The next common injury in the shoulder is rotator cuff. Rotator cuff are the 4 muscles which are very important for all the patients, and mostly this type of injury is usually seen in 30 to 40 years in elders also, because of bone spur formation or erect bone spur formation, And sports injuries mostly with a fall. If you fall and outstretched hand, obviously the cuff really got torn. So minor tears can be neglected, depends upon the extent of the tear and surface of the tear. If it is bothering you, you require a doctor's consultation. You have to assess what is the first sign of a rotator cuff tear is most commonly involved in the supraspinatus muscle, which is important for this movement. If you can't able to do from here to here, then you have to suspect something is wrong with your shoulder. You need to get a scan, doctor's visit. Some people will develop a tricky movements in the shoulder. They can do that, but they will lift the shoulder like this and they will do that. Obviously, their pain won't be in the shoulder, it will be in the back and the neck and sometimes in the front, because you are using other muscle rather than regular muscle. So it is very important. The shoulder misguides us with the tricky movements. So it is very important to differentiate it's a tricky movement from an actual problem. So you have to consult your doctor if you suspect. Other thing is, if you are a chronic thrower, baseball player or a cricketer, you use your shoulder, elbow for throwing everything. Because of chronic irritation, you will have impingements. Impingements is blocking your movement in certain angle. Most of the people will turn your hand inside like this. When the maximum diameter comes under the bone, you will have a pain because there is a less gap in that. Impingement can be a reason for thickened bursa. Bursa is a cushion which gets inflamed by the previous symptoms and it won't give enough room for the shoulder ball to rotate. One reason. Other reason is a small bone spur formation because of chronic irritation between two surfaces. Small bone will protrude out from the main bone, which obstructs the movements. And third, there might be a tear because of the less space in that, and the tear will impinge on that. And posterior impingement. Some people mostly they can't be able to throw completely. They feel I'm getting a pain in the shoulder, this angle. So they will have a posterior capsular tightness. This capsular tightness can be healed by the stretching exercises and proper warm-up before going to the game. Unless switch pathology is there. If it's chronically repeating the same problem, you need to check. Other important is the biceps. Biceps, everyone sees only the bulk of that, but the main attachment will be in the joint. Sometimes with these problems, they can't be able to sleep on their specified shoulder on the bed in the night. They used to wake up because of this pain. So lower shoulder bicep tear can be noted that we call it as in medical terms like a slab tear. Slab is a superior lateral anteroposterior tear. It's a type of labrum tear where the biceps will attach into the joint. So whenever you try to pull or lift at this angle, you might feel that something is wrong in your shoulder. There are so many conditions. Out of this, in the shoulder, the rotator cuff dislocation is the more common reasons. So people without any reason also, they will neglect. Some minor trauma happens and it precipitates, and finally they will freeze their movements. What we say most commonly is a frozen shoulder. Frozen shoulder is true that is 50% of the people. Most of the frozen shoulder is seen in diabetics, where in all range movements are restricted. They can't able to lift, they can't able to sleep on that side. It is bothering. They can't wear the shirt properly also. So it is not true that only diabetics will get the frozen shoulder. Minor neglected injuries, most of the people will neglect, and finally they keep their arms frozen and they visit the doctor. So if you inquire carefully, there's a minor trauma somewhere beyond a long back or some while you are trying to pull it down, there's a trauma, they'll remind slowly and they'll give back the history like initially I had a small trauma, but I don't know whether it is the cause of that. It can be a cause. We need to rule out what is the reason for the frozen. It can be because of tear in the muscle, tear in the ligament, which is neglected and given to the present condition. So always it's better to visit a doctor and get the proper diagnosis. Mostly the MRI is very important to rule out these conditions. Depends upon the progress of the findings of the MRI, progress on the physiotherapy. You need the next opinion, like whether you require a surgery or not, depends upon that. And here also, for every shoulder injury, most important thing is rehabilitation. For rehabilitation takes a prime role. For the minor things, obviously you have to strengthen all the shoulder cuff muscles, various exercises, various level of strengthening things with it. If you are athletic, it's a different level of rehabilitation. If you are a normal person, for a normal activity, it's a different level of strengthening to be conditioned. Your muscles need to be conditioned. So main thing is identify the proper problem is an important thing, and whatever part, whether surgery or rehabilitation or rest, you should be able to get back your normal activity as early as possible. That is a prime aim for any treatment in the shoulder pain or any pain. Thank you.